Before your feet hit the floor this morning, I want you to do something. Right now, wherever you are, take off your shoes and socks if you can. Set them aside and just look at your feet for a moment. Really look at them, because what you're about to hear in the next few minutes could be one of the most important things you've ever taken the time to learn about your own body. And I don't say that lightly. I say it because I've spent the better part of my career sitting across from patients who came in far too late, carrying damage that had been building quietly for years, while the signs were there all along, written clearly across their feet, waiting to be read by someone who knew the language. My name is Dr. Marcus Ellison, and I've worked in internal medicine and chronic disease management for over 2 decades. In that time, the condition that has humbled me most, not because it's the rarest or the most exotic, but because of how quietly and efficiently it dismantles a person's health from the inside, is diabetes. It moves without announcement. It doesn't send a sharp pain to get your attention. It doesn't knock loudly. It slips through a side door, settles in, and begins its work while you go about your life completely unaware. And here's the part that most people never hear until it's too late. Your feet are one of the first places your body tries to communicate that something is going wrong internally. Long before your doctor orders a blood test, long before the diagnosis is made official, your feet may already be showing signs that the body is under serious stress. Today I'm going to walk you through 9 of those signs one by one in plain language so that you can recognize them, take them seriously, and act before the window for early intervention closes. Stay with me through all of them, because the signs toward the end of this list are actually the ones that get missed most often, and they tend to carry the most weight clinically. The first thing I want you to think about is any persistent numbness or tingling that you've been experiencing in your feet. Not the kind that happens when you sit cross-legged for too long and your foot falls asleep. That resolves in seconds and has an obvious explanation. I'm talking about the kind that lingers. The kind where you wake up and the bottoms of your feet already feel distant or muffled, like there's something between you and the ground, even when there isn't. Or that crawling, pins and needles feeling that visits without invitation and overstays its welcome. This is how peripheral neuropathy begins to announce itself. The nerves that run from your spine all the way down to the tips of your toes are among the longest in the body, and they're among the first casualties of prolonged elevated blood sugar. When glucose levels stay high over time, the nerves begin to sustain damage. The signals they send become distorted or weak. Sensation starts to fade, first subtly, then more noticeably, and by the time that numbness is significant enough that you're remarking on it, the damage has usually been accumulating quietly for quite a while. This is not something to file away as something to mention at your next checkup, whenever that might be. This is something to act on. Moving from numbness to its equally unsettling counterpart, the second sign is a burning or aching pain in the feet, and it tends to be most intense at night. I know it seems contradictory. How can the same condition that numbs the nerves also cause pain? The answer is that nerve damage doesn't follow a single script. Sometimes it silences sensation. Other times it distorts it, sending exaggerated or misfiring signals that the brain interprets as burning, stabbing, or a deep ache that has no obvious source. Patients have described it to me as walking across hot sand in the middle of the night. Others say it feels like their feet are wrapped in something electric. Some describe it as a relentless grinding ache that moves through the ankles and up the lower legs. The reason night is the worst time for this kind of pain is that during the day, the constant stimulation of movement and activity gives the brain plenty of other information to process. But at night, when the body is still and the room is quiet, that misfiring nerve signal gets the brain's full attention. If this experience is familiar to you, please don't dismiss it as soreness from being on your feet all day. What your nervous system is doing right now is raising a flag, and it's worth taking that flag seriously. The third sign involves the appearance of the skin on your feet and lower legs. This is one that I've seen people overlook for years because they attribute it to aging or dry weather or just the way their skin has always been. But there's a meaningful difference between ordinary dry skin and the kind of skin changes that develop when circulation and nerve function are being slowly compromised. When blood sugar remains elevated over a long period, the small blood vessels throughout the body begin to sustain damage. This process, called microvascular disease, tends to show up visibly in the feet and lower legs before almost anywhere else. You might notice that the skin has taken on an unusual shininess, almost like it's been stretched too tightly over the foot. It may feel thinner than it used to, more fragile, almost papery in texture. You might observe that the fine hairs on your toes or lower legs have thinned or disappeared entirely because the follicles are no longer receiving adequate blood flow to sustain them. Some people develop small brownish patches on their shins, slightly scaly in texture, that weren't there before. These are sometimes referred to as shin spots, and while they don't cause harm in isolation, they're a recognized indicator that blood sugar regulation has been struggling for some time. If you look down and something about the skin on your feet and legs strikes you as different from what it used to be, that observation deserves more than a passing thought. The fourth sign is one that I've watched bring patients to tears in my office when they finally understand what it means. It's a wound, a cut, a blister, or a sore on the foot that simply will not heal. It may improve slightly and then stall. It may crust over on the surface but never fully close. It may heal and reopen repeatedly. And for a significant number of the patients I've seen, this stubborn wound is what eventually brings them in and what leads to the discovery that they have diabetes. The reason healing is so severely impaired in this context comes down to several simultaneous failures. Elevated blood sugar creates conditions in the body that bacteria find favorable, dramatically increasing infection risk at any wound site. Damage to the blood vessels means that the oxygen and nutrients needed to repair tissue can't reach the wound efficiently. The immune cells responsible for fighting infection and initiating the healing process are compromised in their function. And perhaps most critically, the nerve damage that reduces sensation means the person may not even know the wound is there until it has already become seriously complicated. The clinical term for the severe end of this spectrum is a diabetic foot ulcer, and it is one of the leading causes of non-traumatic lower limb amputation globally. I share that not to frighten you, but to impress upon you how consequential a small, unhealing wound can become when the underlying condition driving it hasn't been identified or managed. If you have a wound on your foot that hasn't shown meaningful improvement in 2 weeks, please see a doctor without delay. The fifth sign is swelling in the feet and ankles. Swollen feet have many possible explanations, so swelling alone is not cause for alarm. But when that swelling is persistent and recurring and appears alongside other signs from this list, it becomes a meaningful piece of a larger picture. In the context of metabolic disruption, swelling can reflect poor circulation, where damaged vessels allow fluid to pool in the lower extremities. It can also reflect involvement of the kidneys, which diabetes is particularly prone to damaging over time. When kidney function begins to decline, fluid retention is one of the first outward signs, and the ankles and feet are typically where it shows up first. There is also a serious diabetic complication involving weakening and gradual fracturing of the bones in the foot, which can produce significant swelling and visible changes in foot shape, made especially dangerous by the fact that the nerve damage prevents the person from feeling the pain that would normally accompany a fracture. Sign number 6 involves the actual structure and shape of the foot. Many people assume that things like curling toes or collapsed arches are simply the result of old shoes or mechanical wear and tear. And sometimes they are, but there's a well-established connection between diabetic neuropathy and the development of structural foot deformities. The small intrinsic muscles of the foot depend on healthy nerve signals to maintain proper alignment and balance. When those nerves are damaged, those muscles gradually lose their ability to do that work, and the architecture of the foot begins to shift. Toes begin to curl or claw. Pressure distributes unevenly across the sole. The arches may change, and because the numbness often accompanies these changes, the person may not feel the discomfort that would normally motivate them to seek attention. What they might notice is that their shoes are fitting differently, or that new pressure points and calluses are forming in places they never had them before. Which brings me directly to sign number 7, which is the presence of thick, unusual, or abnormally located calluses. Some callusing on the feet is normal and expected. But there is a clinical pattern of callousing that raises concern. When the mechanics of the foot are altered by nerve damage, new and abnormal pressure points emerge. The skin over these points builds up thick callus tissue as a protective response. The problem is that beneath that thick callus, ulceration can be developing and progressing entirely undetected because the person has no sensation to alert them. The callus, ironically, becomes a mask for a wound getting worse by the day. And when calluses crack, as thick calluses often do, those fissures become entry points for serious infection. If you have calluses forming in unusual places, particularly under the ball of the foot, along the edges of the heels or beneath the toes, and especially if they are thick and spreading, please bring that to your doctor's attention. Sign number 8 is recurring or unusually stubborn fungal infections of the feet or nails. Athlete's foot and fungal nail infections are common enough that most people don't think twice about them. But when these infections come back repeatedly, resist treatment, or seem to linger no matter what you try, that pattern means something. Fungi, like many other organisms, thrive in high-sugar environments. When blood glucose is chronically elevated, the body becomes inhospitable to its own defenses and hospitable to the very organisms those defenses are meant to control. The immune system becomes less effective at keeping fungal growth in check, and because the underlying fuel source, excess sugar in the tissues, is never removed, the infection returns as soon as treatment ends. If you find yourself cycling through antifungal treatments and never quite getting ahead of the problem, that cycle might be pointing towards something systemic that's worth investigating. And the 9th sign, the one I've saved for last precisely because it's the most overlooked, is persistent coldness in one or both feet. Most people chalk cold feet up to poor circulation in a casual, general sense, or to simply being someone who tends to run cold. And for many people, that's all it is. But when the coldness is persistent, when it doesn't resolve after warming up, or when one foot is noticeably colder than the other without an obvious explanation, that asymmetry and that persistence is clinically significant. Diabetes damages not only the small blood vessels, but the larger arteries as well. This large vessel disease, known as peripheral arterial disease, is far more prevalent in people with diabetes than in the general population. When the arteries supplying blood to the feet and lower legs become narrowed or impaired, the volume of warm, oxygenated blood reaching the foot drops substantially. The foot becomes cold to the touch, and that coldness is not just a matter of comfort. It represents reduced oxygen delivery, reduced immune activity at the tissue level, and severely diminished capacity to heal from any wound or injury that might occur there. Pair that with the numbness from nerve damage, where the person can't feel what's happening, and you have a situation where serious damage can develop with virtually no warning. If you've been nodding along at any point during this, if one or two or more of these signs have described something you've been living with and maybe quietly hoping would go away on its own, I want you to hear this clearly. There is nothing to be gained from waiting. Diabetes and the complications it produces develop on a timeline that doesn't pause while we work up the courage to make an appointment. The earlier the intervention, the more of that timeline you reclaim. Blood sugar testing is simple and accessible. A basic panel can tell your doctor more than months of uncertainty ever could. The conversation you have with your physician this week could genuinely change the arc of your health in the years ahead. Look at your feet today. Look at them tomorrow. Make it a habit. The body speaks before the crisis arrives, and the feet tend to speak first. The only question is whether anyone is paying attention.